So T cells are a type of white blood cells, part of the immune system. T-cell lymphomas basically refer to cancer of this type of white blood cells. T-cell lymphomas are in general much more common in Asia compared to the West, and our group has decided to focus primarily on T-cell lymphomas. The purpose of this study is to characterize type 2 ETO, which is a disease which is up to now rather poorly characterized. And our study basically looks at a largest number of cases we have in the literature thus far to understand the characteristics of this disease better. The important thing is that our study found that type 2 ETO is very different in terms of its characteristics from classical ETO, that it is not associated with this intestinal disease or celiac disease that we talked about. And we have also identified a biomarker that is characteristic of this particular tumor. This marker will enable us to better more accurately diagnose type 2 ETO and distinguish it from other types of intestinal T-cell lymphomas.
This finding is very useful and important now because it can allow us to make an accurate diagnosis of this rare condition. And with this accurate diagnosis, we can more accurately classify the patient, characterize them, and then stratify them to the accurate treatment. And this finding potentially can also translate to targeted treatment. They allow these patients to be given more personalized treatment, and hopefully with that, better outcome.
In translational research, collaboration is very important because we can draw on the skills, expertise, and the patient from different institutions. So that will give us the power that we need in our analysis for our projects. In this particular project, with our findings, we want to continue our research to understand the underlying molecular cause of this disease, so that we hope we can identify the therapeutic targets that will lead to an effective therapy.